Dr. Marc DiNola, thank you so much for joining us on the Planterners podcast today.
Thanks for having me.
We are excited to talk about all things holistic dentistry and oral hygiene and mercury and all of that. But before we do, we of course want to hear your moment of gratitude.
Well, gratitude just being here on Earth. I feel like, my family, obviously, and my chosen career has been a blessing to me, and I'm grateful to have the mental capacity and the hands to do the things I do. So, yeah.
Well, thank you for the things that you do. We've spoken before, and I'm so inspired, and I love what you're doing for your clients. You're going beyond just, getting the plaque taken off, getting the cleanup, taking the x-rays. You're really looking at the whole body, and you're really looking deep into what could be causing health issues beyond what we know about already. And we're going to get into that. So why don't you first tell us a little bit about how you found the holistic dentistry life?
Holistic, that's so strange though. Like, you don't really think about dentists as being holistic, that you just go into your dentist and work on your teeth. So maybe you could also explain why or what a holistic dentist would be.
Well, we say holistic, biological, or integrative, and all those terms sort of apply to the fact that the neck bone's connected to the spine. Basically we joke about that we're one unit. And honestly, the whole epiphany came to me when a patient, how it's like a blessing, you have a patient bring you information that you might not have known. And so that's why I'm always open, because I'm always open to new information, because quite frankly, we weren't told the truth about amalgam and other things. So someone gave me some information in 2009 that led me down this path, down a rabbit hole. I like to say, we say in podcast land, right? But I always think it applies to dentistry, especially this with regards to mercury, because as you know, there's the Mad Hatter in Alice in Wonderland, and the rabbit hole scenario is digging deep into something you have not explored before, or deep end of the pool, isn't it? There are so many terms we could say, but I have always loved nutrition and health and eating. I'm Italian, and I like to talk about food in general, but the idea that food is medicine, the idea is that the teeth are connected to the rest of the body, and the gum health and that kind of thing. So it's almost like silly to think about that it's just teeth and gums when you come to the dentist. So it is one way to look into the body. In fact, you're looking in the body when you look at someone's mouth, right? And so that's the beginning of the alimentary canal. And there are a lot of things that influence certain organs. And so we'll talk about that, but it doesn't make sense anymore with the research and things that we're learning to just think about that we are carpenters in the mouth, where we work on the teeth and try to get the jaw right. And but so the lymphatic system is addressed in my office, because the lymphatics can drain right to here on both sides. If you look at the pictures of on the internet, if somebody wants to do that, they'll see that the lymphatics are draining all the time from the head and neck, and that's part of the system. So that's almost the reason why, around a blood vessel, there's a lymphatic system, and that's the reason why I need to pay attention to the whole body.
Absolutely. So for those people who are only listening and not watching the YouTube, when he said right here, he was kind of talking to the side of, it's okay, the side of the neck, from about under the jawline down the carotid artery area, and then back into the shoulder. So that's where the lymphs tend to be affected quite often. And you mentioned amalgam. Can you just explain to people for a minute what that is?
Yeah, amalgam is amalgamation of different metals. And in the past, 150 years ago, it was a necessary evil, I guess I would say, because we did not have the restorative materials we have today. In fact, there was really only gold, which was expensive then and expensive now. And so in the 70s, they developed composites, and that's when we probably should have switched out a lot of what we do. although that was, you know, a test time because they didn't know how strong things were. But amalgam is a amalgamation of, it comes out of the mining industry actually, because that's the way mercury is used and cyanide is used, but mercury is used for removing or chelating or grabbing up or amalgamating with iron, with different ore, gold ore to pull the gold out, or silver. And so when somebody decided to, I can go into the history, but I don't want to right now. I don't think it's important, but for all intents and purposes, it was developed as a way to restore teeth that had decay, which we could talk about why that is, but that was pretty much the ubiquitous nature of sugar. But so as a necessary, you know, the saying of amalgam, I say, the ADA likes to say silver fillings, but if you say a cornflake's a cornflake because most of it's corn, then you have to say a mercury filling because it's 54% mercury, then about 30% silver, and then there's copper and tin. And so these are combined, and we were told that they're stable, and that's not really the case. And I'm so glad you have me on because I just want to disseminate this information. And I think that knowing that that's not a stable thing and that vapor's coming off of amalgam fillings and they're getting into our bodies, we're breathing it, we're swallowing it. And there are many studies, thousands of studies at this point on that. But I can go into a little bit later. Maybe we could talk about the possibility that some people shouldn't have amalgam fillings and some people it's okay to put fillings in. That's what was stated by the FDA in 2020. But so that's what an amalgam is, and it is initially it's liquid, and then it basically fuses into a solid piece. And we were told that it's stable at that point. And so
yeah, for many years, people with cavities have had their teeth filled with this mercury filling, I guess, right? And so you just mentioned that in 2020, they said that that was not a good thing to be doing. And so I believe there are people that are now having their mercury fillings removed to fill it with something else. So I guess, is that necessary? Is that something that everybody should be doing? Or is it safer once it's already in there to just leave it alone? Because I'm sure there's repercussions either way, right?
Yeah, I guess what I will say is that the safe removal is a necessity. It has to be done in a safe manner, and I can explain that probably further along. But the point that you made about had amalgams placed, people are still putting amalgams in. This is the problem. And this is why I'm kind of being a squeaky wheel. I'm an ADA member, but I'm still being trying to tell people what I think is the truth. And anyway, so about 50% of dentists or 40% of dentists are still placing amalgam fillings. In certain situations, it's more difficult to place a filling near, you know, the gum line or near places where it's hard to keep things dry. But what we do, I mean, you asked a lot of questions there, but composites are seemingly safer, way safer than an amalgam because mercury is very toxic. It's probably the most toxic non-radioactive atom there is, and so, or element. And so the question about removing them, I think that no human being should have amalgam in their mouth. Whether they're stable or not depends on if they're stimulated in certain ways and heating them up, and if you're grinding your teeth and what we call it bruxism, if there's grinding going on, that creates friction. So there is the ADA and the FDA both have on their website that vapor comes off of amalgam fillings, and the question is that affecting an individual in a certain way? And so if you have your audience is probably pretty smart, but they probably know about MTHFR and some of the methylation pathways. But if they're a certain allele and they're certain heterogeneous or homogeneous, you know, these are problems with detoxification. And it depends on how someone's bucket is. If someone's bucket is way high, If they're having autoimmune or immune problems, mercury affects the white cell, it affects the thyroid. I mean, I could go on and on about everything it can affect, but I kind of reverse engineer things. I never tell anybody I can get them better, but I'll reverse engineer in terms of if they have a thyroid disorder, for example, and they have amalgam, well, I tell them the pathway for that situation. Or if they have a lot of gut issues, I talk about the gut health and the mercury. If they're cognitive difficulty, brain fog, then we talk about it that way. I never promise anything because I'm not a physician. I never promise I can get them better, but I say we'll take that toxic load away, empty part of that bucket, and then it helps with other pathway. It helps regenerate the detox pathways, because that big burden that's there, the body's trying to really hold tight to what it has. And then if that's eliminated, the source is eliminated, then the body could start to open up again. So people like you, I work with a lot of practitioners that are opening up pathways first to try to get people to go to, poop every day. And that's the difference between a biological dentist and a regular dentist. The regular dentists or traditional dentists might not ask that question. Do you poop every day?
Well, we like talking about poop here for sure. I just want to make sure, I'm pretty sure the ADA is the American Dental Association.
Yeah, the weird thing is it's also the American Dietetic Association. I mean, there's two there. So American Dental Association. And,
perfect.
I believe that they're important, but we also need to recognize the truth about some of these things.
Right. So in terms of the truth, so when we spoke a couple of months ago and we were talking about the MTFHR gene, and I was telling you that I have a lot of clients with the MTFHR mutation, and that we're working on detox with them. We're working on a lot of different things with them. And so it got me asking some of those clients, hey, do you have any fillings? And a majority of them have said that their fillings were actually removed.
Yeah.
So is it just from my anecdotal asking, or is there actually a big link between people who are still sick now because possibly their mercury fillings were not removed safely, and then mercury's been absorbed into the body?
Yeah, I mean, there's a couple of things just to back up a bit about. We could talk about other genetic factors, but one's ApoE, which is actually an Alzheimer gene. So ApoE, ApoE4, ApoE24, and so it's sort of a ubiquitous housekeeping protein that's in the body, and so that's the other one that we really look at. Not everybody has those tests, but they usually know if they're not methylators for some reason now by the time they go through some functional medicine tests. But the question about safety, if someone is susceptible and shouldn't have had them in the first place, or is more susceptible individual, unsafe removal can cause a vapor cloud, which is why we talk about safety, because when you're drilling on I'm sure people have seen like sparks on things, but when you're heating up anything, we're trying to cool it, but at the surface level, when you're cutting something, there's heat, there's vapor generated, and that we have to handle that. And it's about 3,000 micrograms per cubic meter, which is just an unseemly amount. And it's actually, it passes the permissible exposure level at that moment, which is only like 24 micrograms per cubic meter. So it is why there's an occupational exposure for dentists and hygienists and dental assistants. And this is the truth. And I'm sorry, like, to hurt people, but in terms of this information, it just needs to be told. And there are plenty of people doing it before me. The group that I'm involved with is the International Academy of Oral Medicine and Toxicology. And they have nice videos about the safe removal protocol, which I can go over if you want, but it has to be done that way. And if it's not, there is a potential for introducing that last bit that fills that bucket to the point where there's something that happens. Now, we say straw that broke the camel's back, but you've seen that with Lyme and you've seen that with mold. And so if someone's toxic bucket is full, it might just be that last thing that gets them in trouble, so it has to be done safely. So we can talk about the safety. I'm sorry. We can talk about the safety.
Don't be sorry. I wanted to say, if somebody says, okay, I don't want to, like, you know, I've got a bit of depression, or I've got some autoimmune disease, or I don't feel 100%. So if my cavities are creating this, if my fillings are creating this, then I want to just get rid of them. So let's say they want to get rid of them and they go to their dentist, and what questions do they need to ask if they practice safe removal? I mean, a dentist
That's
isn't
right.
going to say, no, I do it in the most toxic way
Nobody's going to say
properly,
that.
right? Nobody's going to say that. So what specific questions do they need to ask to make sure that they are following the correct protocol, and not just the protocol that the dentist feels is correct because they haven't necessarily done enough research themselves?
Well, I just like to say that I know we're probably only 1% of all dentists, so majority of people will not have a holistic dentist. If they know, they would already know if they're holistic. But if you ask the questions and you try to set a dentist up to do it, you have to ask them about the safety protocols that are totally mandatory, which are a rubber dam that's not latex, because mercury goes through latex. There's a suction that we use that has sulfur filters and filtration systems within the room. I also have a negative ion generator, which is supposed to mitigate any kind of vapor that might miss those 2 or 3 suction things we have. We also, you know, we're always on the filling, and we're always rinsing it off. And the rubber dam is that gasket between where the teeth are sticking through and the mouth. It's actually very pleasant to have work done that way because all the water doesn't go back. So we use it a lot just for fillings, regular fillings, or things like that. But those particles will not go into the body. In fact, before we do all the necessary setup, we'll have them take about half a cup of activated charcoal, and they'll swallow that. So there's like the idea that that's helping. If any particles get in, we're trying to capture it. Some people I use a sulfur compound that's a chemical, so I don't put it on the skin of my patients, but I put it on the rubber dam, I put it on the paper, and I put it on different places. And that's supposed to help with vapor grabbing onto these sulfur groups, which is kind of, mercury's like it's a bad guy, it's a bad atom that looking for electrons, so it'll go after sulfur groups. That's why it affects the sulfur amino acids like methionine and cysteine, and so it's looking for to grab up an electron, and typically it's like these side chain amino acids or parts of proteins, and that's why that ApoE, going back really quick, that's why that ApoE is important, because there are susceptible proteins that are ApoE, and their sulfurs on the outside, and so they get grabbed up, and then the protein gets distorted and the enzyme gets distorted. But if the sulfur's inside tucked in, that's another one of those APO. It's actually 2,2 is safer than, and then 4,4. So some people are saying if you have 4,4, you're going to have Alzheimer's at 60, you know, or potentially have some dementia possibly. And then, you know, if you're 2,4, it might be 80. And if you're 4,4, you're going to probably not have that happen. You'll probably die of a heart attack or something else.
So how does somebody know or make the decision that they should remove their mercury fillings if they have them?
So the decision should be a thoughtful one. It should be that you feel like you should always discuss the money part of any of these things, and you want to look into that before, because you don't want to be blindsided by that. But I think if you have any autoimmune, if you have Lyme, if you have cognitive difficulties, if you're on a bunch of medications for things like hypertension, if your gut's always a wreck, I mean, these are things that if you clean up the diet and they're still going on, you might start thinking about whether it's something else. The one interesting thing is some cognitive stuff, because they are like batteries. So there's something called galvanism, which was studied more in the 30s and 40s when we didn't have all the other things we have now and technology we had to learn. But it is a current. So by definition, a battery is 2 dissimilar metals in an aqueous solution, and a mouth has salt solution, and then the metals, of course, I went over that, but you know, up to 5 different metals, you know, could be an amalgam. So there is this little current, and it actually is about 100 to maybe even 1,000 times the amps of a brain. So it can affect people, and I've had patients that were suddenly miraculously feeling better, and I guess I contribute that to the galvanism affecting them, electrical. So you know how there are electrical sensitive people, and there are people that you don't have any trouble with that, and I think that's where that comes from.
So interesting. So how would you determine in the first place if that person, you said before, some people can manage those amalgam fillings and some can't. So how would you determine if you can or cannot?
How you could
You
know
said
if you
some
need them
people
out.
can tolerate, some people
Oh
can
yeah.
tolerate it, right? So if I'm assuming that's going to be I'm assuming it's the cheapest way to fill a cavity, and that's why most dentists do it, and that's why most people would opt for it. Plus, they would probably not even realize that there's another option. So who would it be safe for?
Well, I don't, in my mind, there's nobody that it's safe for, but I would say like I think you asked before that, you said, how would you know who, so the categories that the FDA has stated that maybe someone we shouldn't put amalgam are someone with kidney dysfunction. So amalgam filling in person, their kidney becomes unable to excrete mercury after a certain amount of time. So if you have a kidney problem already, you would never want a filling, and I would never choose it in the first place. But I'm for the example of what the FDA said. So any kind of dementia or cognitive problems, children under 8. This is how silly it is. If you just had your birthday, you can get an amalgam filling. Doesn't make sense to me. And then at the end, if you read, it says if the dentist or the person just considers them medically necessary to be removed. Now, how do you determine if it's medically necessary? That's the question you're asking me, like sort of in the roundabout way. I would say if you have autoimmune is a huge one, but there's so many things I can list from my knowledge here, but I forgot your question.
That's okay. I was asking how do you determine if it would be safer for you, and I guess then also determining who should get rid of it as soon as possible.
Well, if you never had an amalgam filling and you were only going to get that, then you would know, because there are cases where people get sick afterwards. And then if you have them your whole life, I've had these all my whole life, and well, they don't know how good they could feel on the other side of getting these removed, or they don't know what could go away. Like 3 hypertensive medications goes to 1. There are things that can happen where people feel better. And I think that they don't know, well, with your clients, my patients, they don't know that they could feel better. I mean, the biggest example is sinusitis. If you have an allergy, which is another issue with mercury, if you have an allergy to this metal, which they can't test for because they won't allow you to do a patch test with mercury on your skin because it's toxic, right? So you can't test for that.
But you could put it into your teeth.
Yeah, you can put it in your teeth. Well, it's hazardous. It's hazardous in the container, and then it goes in your mouth and it's safe. And then when you take it out, it's hazardous again. That's because I have to get a special, that's another aspect of what I consider safe removal, is protecting the environment as well. So we have a scavenger in our basement, it's sort of in line with the suction. So it drops, the mercury drops into a container, and then the rest of the effluent goes out. And so that's one other aspect of it. But you can't dump that into the rivers. You can't dump that into, so it is toxic. It's toxic.
So you mentioned before thyroid, and I'm seeing clients more and more and more with thyroid issues. I actually get people come to me and they tell me what's wrong with them and what's bothering them. And I say, is there anything else? And they say, no, otherwise I'm totally fine. And then I find out that they feel totally fine because they're on thyroid medications, but they do have a thyroid issue as well. So it is so prevalent. And I think there's a lot of reasons out there for it, but how does the mercury affect the thyroid?
Yeah, the thyroid has a number of, not to mention that it's just the mercury is an oxidative stress. So you already have magnesium going down, and magnesium is required, selenium is required, and then you need tyrosine and you need iodine. So what happens is iodine knocks out, or mercury knocks out iodine on the receptor for receptor sites. So halides in general have more of an affinity than iodine. So bromine, chlorine, fluoride, mercury all can bump out the iodine. So that's the one thing. And then the other thing is selenium is a natural chelator in our bodies for mercury. So you could be depleted of selenium just because the mercury is gobbling that up. And you can look at all these pathways and say, what maybe isn't happening in my body if I don't have enough selenium, right? The other thing is it does directly affect the enzyme to bring T3 to T4, I believe, or just to make the thyroid hormone. Yeah.
Interesting.
But yeah, so I ask patients if they're on Synthroid, I said, do you feel not as good as you did when you first got on the medications? You can ask that question too. And it's usually, I felt better when I first got on it. And what tends to happen is they don't, they sort of burn out. So I usually ask them to ask their physician or naturopath to switch them to Armor, which is, or Sun made, or Sun, there's a couple different names for it, but it's more of the natural desiccated one that was used in the past, and it comes in like grains, and so you can take a certain amount in the morning, and it has a ratio of T3 to T4. Synthroid, I think that's only T4. So anyway, there's this whole thing, what is a functional thyroid hormone? Anyway, I don't want to get into it too much, but a lot of times they can have a goiter, or it's not heterogeneous, it's heterogeneous and not homogeneous on a sonogram. I ask them if they have dry skin, losing hair, don't go to the bathroom every day, constipation, and that's kind of, or they can have some issues with their heart and racing. But people are put on these medications and they think it's just because my body's going south, but they don't know they have mercury fillings affecting it. And it's sad that, physicians aren't asking that question all the time.
I want to switch gears for a few minutes and talk about the fact that so many people these days are consuming smoothies and drinking their calories. And for some, they have different reasons for doing it, getting in high nutrients with a fast-paced world and just blending everything. But I'd like you to share with us the importance of actually chewing your food versus drinking your food, because we know that that is a super important piece to our whole body's health. And I think coming from a holistic dentist, that might be something that you should probably share with our audience.
Yeah, well, some people think that a lot of the problems are that we have mushy food these days and we don't really have the textured food. So when we say eat a carrot, there is a compressive force on that. And the anatomy of a tooth is, I'm using my hands again for those people on the radio. There's a housing around a tooth that has a ligament, and there are different fibers that are stimulated. And most people understand that you need to move to build your skeleton. It's the same deal there in the jaw, and the alveolar bone requires, mastication, which is chewing forces. And the chewing forces are distributed in different ways on different teeth. When you incise your food in the front, you're cutting it, and then you move it to the back, and the back, it's called an occlusal table, and your tongue, not knowing, you don't think about this, is all autonomic. The tongue flips the food to either side on the table, and then you move it over your tongue and mix it with your enzymes and saliva. I mean, it's a process that we need to go through. So we were talking earlier about maybe before we got on the podcast about possibility, and I believe it's true. There's things that teeth do that we don't know about, and it could be that they are setting up the enzyme systems for certain food and textured food or whatever. And the smoothie, I don't think it's terrible to have a smoothie. I feel like that's not a problem. I would be careful about the sugar, which I would love to talk about with you. But the fact of the matter is, the amount of insults that that teeth can handle in terms of resisting decay is probably a few meals a day. So you have to be careful the frequency that you have a smoothie, frequency that you have sugar or food. I'm not really for having like 8 meals a day or something like that. It should be like 3 or 2. Maybe some people are arguing intermittent fasting is important, maybe to tighten that schedule even to like 4 or 5 hours or 6 hours, maybe even better to eat 1 meal. But that's hard for a lot of people. So yeah, I guess. And so that's what I would say. The chewing forces will keep the alveolar bone healthy. We know this because if you have aberrant forces like bruxism and grinding and stuff, those forces actually cause bone loss. So we know because they're shearing forces the wrong way. Anyway, that the fibers actually pull on the osteoclast and osteoblast and sort of stimulating that pattern around the teeth.
So let's move to sugar then, because we were told, as a kid, everybody loves candy, and we were told that sugar is not good for us. It's going to rot our teeth and we shouldn't be eating it. And some people think that that's just a myth and it's just to get you to stop eating the candy. But so I guess, is that a myth or is it true? And also, is there a difference between that kind of simple sugar and then the sugar that we get from a complex carbohydrate, let's say, or an apple or a fruit or that kind of sugar versus the candy kind of sugar?
You guys are good at asking multiple questions at one time. I don't mind. It just remind me if I don't get to the whole subject.
No problem.
Yeah. Well, an apple is different than a piece of candy, and we can talk about fructose versus sucrose. Really, the issues regarding like carcinogenicity, which is cavity producing sort of qualities about a food or a substance. So there are also different theories about how decay and what decay is, and we can get into K2, which is something we were talking about before. But when I was in dental school, it was like sugar is metabolized by certain bacteria, which is true, and the bacteria make an acid which dissolves the tooth, which is true, but that's not the whole story. So we're really learning now that there's a bigger picture. It even goes down to maybe ancestrally what we ate or things. But I also have a theory that the taste bud is so sensitive because sugar was not the way it is today. And so the taste bud actually releases dopamine, like indirectly through an afferent nerve. So you have sugar, hits the taste bud, pops dopamine in your brain. No wonder people want to eat sugar. It's a quick, it's like slot machine if you win every time. Or maybe not if you win every time, but it's intermittent reinforcement in that regard. But as far as the sugar, like in an apple, in a fiber, it's different. It's handled differently. It's not high fructose corn syrup. It's just fructose. But the bacteria that cause decay are a kind of a duo, but strep mutans is the one that will metabolize sugar. But it is the abundance of those strep mutans. That's what I think when we start looking at what the diet is. If you're eating a lot of carbohydrates all the time, guess who's going to grow and guess who's going to win at that party? It's going to be the ones that like sugar. I mean, including yeast and other pathogens. So your question about what is it different? The sweetness that I like is honey, maybe some maple syrup. I'm not a big advocate of sugar in general, but yeah, the story's changing with the K2. We can go into that if you want to, but we found out now that the parotid gland, which is our main, producing saliva gland, is up to 60 to 65 or more % of our saliva is from our parotid glands, which sit on the side of our jaw. And people probably know when they eat something sour, all of a sudden they feel something there. That is actually expressing a lot of the duct is a little bit above the molar, first molar. Sometimes people bite it accidentally and it gets swollen. Sometimes you get calcifications there. People that might be listening, I'm pointing to my first molar. But the idea, these ideas are basically saying it's a systemic problem. So we know that caries and susceptibility to decay is a systemic problem, not just what you're eating. And so that's kind of what I would say about the balance of what we know today.
So then that kind of makes sense for the question that I was thinking. I don't know for sure, but I think I grew up eating a lot more sugar than Adam did. But by the time I met him, he had a lot more cavities than I did. I had 0. So, but I ate a lot of sugar. So
I think it's genetic too, isn't it not?
I suppose so. I think it's the microbiome. Like, you know, we say we get our bacteria from dogs, mothers, and lovers, and you know, it's really it is a microbiome thing. You know, we're learning about every place on our body has a biofilm. So our microbiome in our mouth is key. You could have if you had a mother or father that had periodontal disease, potentially, and probably you're swapping that sometimes if you kiss certain ways. And so that's what I would say. You get inoculated with the wrong bugs or the right bugs, and immune function and those things, and how we handle also. Diet is huge, but you know, are you told to brush your teeth and disrupt that plaque every 24 hours by your mom or dad, or do you have that, you know, capacity? You know, I saw an autistic kid this week, broke my heart, 23 years old. You know, he can't clean his teeth, but they don't give him sugar either, you know. So anyway, I don't know if I answered the question that you wanted me to answer.
Yeah, that's okay. That brings me to another question. But before I get to that, you mentioned K2. So we quickly need to tell people what K2 is and where they can get it if they need to be taking it.
Well, for your audience, a great source would be like the way the Japanese eat fermented soybean. It's called natto, and natto may be like in a grow factory where they're getting the supplement. So you can do K2 supplement. And I don't know how you feel about me talking about other sources. I mean, I do eat cheese, and I do eat eggs, but it's in yellow fat. It's in the fermented food. So I just bought fermented carrots and some fermented pickles. And so I think that there's this thing that the bacteria are turning over, and that we're not as good at doing that in our GI as other, you know, as doing it the way the bacteria do it. So it's a conversion of K1 to K. It's actually chlorophyll, K1, K2, and then it goes up to, I don't know, MK7 or 12 or something by now. But that K vitamin has actually been shown to facilitate the calcium metabolism in terms of bringing it into a odontoblast or a tooth cell or a bone cell. So it in the bloodstream, you have to have a pretty finite, tightly bound down, or tightly calcium. You know, your calcium has to be a certain concentration or you'll have trouble. So the body intuitively will precipitate out the extra calcium, either arteries, kidneys, or tartar in the mouth. So the K2 brings that calcium into the cells, and it activates a couple proteins that sort of carry it in. And if you are lacking K2, there's a possibility that you have heart issues because of plaque, different type of plaque in your heart. And you know, the question, we can go on a question of people that are on blood thinners. It's a tricky situation, but you can take K2 if you're on Coumadin, so it's not going to affect the clotting. It's a different animal, you know, it's a different element in the body.
Right. So, and before we ask you where people could reach out to you, you mentioned brushing your teeth before, and it brought up a question that I had, which was that a lot of people are starting their day with lemon water. And I wanted to know if there is an actual impact of drinking the lemon water and then brushing your teeth right after. Are you really scrubbing away some of your enamel, or is that just another myth that people talk about?
Well, your body or your plaque, your microbiome, and your setup with a pellicle, which is this film that's on our teeth. We have a buffering capacity in our teeth to resist cavities. So a one-off like slug it back vinegar apple cider vinegar, which I like. I don't think that's a problem. But if you're sipping apple cider vinegar or lemon juice all day, you're going to have a cavity. You're going to have problems with etching. I mean, we use phosphoric acid to etch a tooth, and the pH of some of these things. Now, I understand that it changes, once it's systemically in your body, but surface is acid. So, yeah, I mean, I would do something to mitigate that, but I don't think you should not do the lemon water. I like that idea of, yeah, I don't know if I answered your question, except it does bring back the frequency issue and that I mentioned before. Like drinking smoothies all day long is not going to be good if it has sugar in it or acid in it. So, yeah,
Cool.
that's a good question. Yeah.
Yeah, great. So thank you for answering that. Dr. Marc, if people want to reach out to you, where would you like them to go?
Well, first of all, I want to say that I can't do this alone, and my colleagues that are in the IOMT, which is the International Academy of Oral Medicine and Toxicology, has a map, so you can put in your zip code, and you can find the people that do what I do, because I can't handle everybody that's going to come out there, because there's 100 million Americans, first of all, with amalgam, and they're being placed still, so it's continuing, but I have a website, mddentalwellnesscenter.com, and I have a YouTube channel with my name, MarcDinola. We are in, you want to know my location? We're in Western Maryland. So we are 2 hours from Pittsburgh, 2 hours from Baltimore, 2 hours from DC. North of us, sort of directly north of us, is Altoona and Bedford, Pennsylvania. And south of us is West Virginia. The panhandle of Maryland just looks like the panhandle of West Virginia, moving out to the west. So we're 70 miles from Morgantown, WVU. And
oh, we know that. We pass through there every year on our way down to Florida.
Yeah. Very cool. So we'll link to your connections in our show notes at planttrainers.com. And Dr. Marc, thank you so much for being with us today on the Plant Trainers podcast.
Thanks for having me.